Did you know your entire hospital visit could be judged by just 2 seconds? Today we explore the peak end rule, a cognitive bias proving that duration is often forgotten while intensity and endings define our memories. Coined by psychologist Daniel Kahneman, this memory heuristic reveals that we retrospectively evaluate experiences based primarily on their most intense moment, and how they conclude, largely neglecting the total duration of the event. In a study by Kahneman and Ziv Karman regarding waiting times, participants interacting with a computer program proved that dissatisfaction didn't necessarily grow linearly. Instead, it was dictated by specific peaks of anxiety or relief during the wait. This rule is closely related to the recency effect, meaning items near the end of a sequence are easiest to recall. A rushed first interaction or a distracted therapist creates a negative peak of anxiety that overshadows the actual quality of care. Consider a clinic that smells strongly of antiseptic and indifference. This sensory detail becomes a negative peak. If the staff is warm and welcoming at the very end, patients' memory improves dramatically despite the initial harsh environment. Companies like MailChimp use this principle to manage user emotion, but in healthcare, ignoring it leads to lower satisfaction scores. We must actively manage the emotional peaks and ensure a positive conclusion for every patient journey. The most surprising fact is that our brains are wired to ignore the middle. Even if treatment was long and difficult, a single moment of extreme pain or a comforting final handshake will determine your overall satisfaction rating. So there you have it. Our brains are wired to judge by intensity and endings. How has your own experience been shaped by a single moment? Share your story in the comments below.